Hello, good evening, friends. Today, let me tell you something about what is called as alcohol withdrawal syndrome. Patients or persons or subjects who have been consuming alcohol incessantly for days together, for weeks together, or perhaps for months together, when they suddenly stop consuming alcohol, what happens? They develop what is called as alcohol withdrawal syndrome. When does it start? It starts perhaps as early as 12 hours after the last drink of alcohol. It can start anywhere between 24 and 48 hours also after the last consumption of alcohol. It's a calamity, it's a catastrophe. It can cause problems if not treated at the right juncture by a medical professional, to be more specific, by a neuropsychiatrist. What is the patient present with? A person who has been a chronic alcoholic. When he stops alcohol suddenly, he can develop what is called as tremulousness of hands, tremors of hands, tremors of the entire body, shaking of the lips, tremors of the lips, etc. He can be restless. He can be apprehensive. He can be anxious. He can be agitated. He can't sit still at all. He paces around, my friends, as if a great catastrophe is about to occur. Such people can also have what's called as nausea. They can have an intense vomiting also. Their heart rate or pulse rate, if you measure, it will be a high bounding pulse, and their heart rate can increase to enormous proportions. Can they recognize themselves? Can they identify who they are surrounded by? Can they recollect where are they sitting? Where are they standing? Can they identify or recognize a person who is in front of him? No. This is what's called as disorientation. Disorientation to what? Disorientation to time, meaning he can't clearly, distinctly make out what time it is. Is it daytime? Is it not night time? He can't recognize who is standing in front of him. Is it my wife? Is it my relative? Is it my doctor? No, he can't recognize. If you ask him to recollect what articles of diet he ate that day morning, I'm afraid he can't recollect. He can't remember. He can't decipher things clearly at all. This is what's called as disorientation to time, place, and person. Sometimes these people can have what's called as sphincter incontinence. Sphincters, either urinary sphincter or the anal sphincter. Persons are not in a position to recognize as to how to pass urine or as to how to pass stools also. This is called as incontinence, sometimes a double incontinence, as I told you, my friends. They can have intense, excruciating headache. What happens to their sleep? No, they can't sleep at all. They're very severe sleeplessness. In medical terms, we call it as insomnia. Sometimes, God forbid, these persons can throw very severe fits. What are they called as? They are called as rum fits in psychiatric terminology. Any fit occurring after the withdrawal of alcohol consumption, it's called as rum fits. The analogy I need not elaborate, my friends. Sometimes they can have intense voices being heard in their ears. The voices can say, your wife is not good, your friend is not good, kill him, kill her, or this life is not worth living at all. You are a botheration to the society. You are a botheration to thyself. Hence, please go to the top floor of the building, jump from the terrace, and end your life. The hallucinations can be commanding in nature. They can be threatening in nature. They can give ideas. They can give ideas or suggestions to either kill himself or to kill someone else. Suicidal ideations or sometimes homicidal ideations also can crop up in such individuals. So, this is something about alcohol withdrawal syndrome. It is also called as delirium tremens. Mark my words, if left untreated, it can result in fatalities. It can cause death of the individual. Hence, the urgency of such persons who stop consuming alcohol, who develop alcohol withdrawal syndrome, hence the urgency that they be taken to the nearest possible professional psychiatrist who can save their lives. In our institute, we have trained professionals to undo alcohol withdrawal syndrome and to restore normalcy to such persons. We have a professional colleague who has been extensively trained in England and in Vancouver, Canada. To treat such patients, my friends, you can approach a psychiatrist to undo all such calamities. All the best. Thank you. God bless you.